Here are some of the most common mistakes nurses make whenever they start IVs. The first mistake is failing to anchor the vein. So really, anytime you start IVs or even draw blood, you want to go and anchor that vein. And the reason you want to is because whenever you go to insert by putting pressure on that skin with that needle, if that vein is not secured, it can just go to the side. And we sometimes refer to that as a rolling vein. And to prevent that from happening, what you want to do is you want to take your hand like this, go below that insertion site, and just simply hold pressure just to keep that vein in place while you poke it. Next is hitting vein valves. So in your veins, you have these little valves that prevent the backflow of blood. Now, how can you know if you're going to hit a vein valve? Well, look at your patient's veins. You can palpate and you may feel this little knotty region along the vein. That could indicate a valve. Or if your patient has a low body fat percentage, you can actually see them visibly on the skin like here. So the problem with this is whenever you actually go to hit the vein and you go to slide off the cannula, you'll have difficulty sliding off that cannula. And some nurses, to prevent this, they try to float in the cannula by flushing as they advance. Another mistake is failing to advance that catheter once you get blood return. So it's extremely exciting whenever you're starting an IV and you get blood return because that tells you you hit that vein. But you're not quite ready to advance that cannula into that vein just yet. On the adult patient, what you want to do is once you get blood return, you want to slightly, about the width of a nickel, insert that needle just a little bit more into that vein and then slide off that cannula, and it should go in very easily. The next is using a tourniquet when you really probably shouldn't use it. So not all situations whenever you're starting IV require you to use a tourniquet. Some patients, when they have amazing veins like this, they're already visible at the surface. They literally look like huge night crawler worms underneath the skin that you could just poke from across the distance. You wouldn't necessarily want to use a tourniquet. And the reason for this is because you're going to be putting a lot of pressure on that vein. And whenever you go to poke it, think about like a balloon concept. If you went and poked a balloon with a needle, what's going to happen? It's going to pop. And in a sense, that's what's going to happen to that vein. It's going to burst open underneath the skin. Another thing is using the wrong needle gauge. When you're starting IVs, you want to look at that vein that you're using and ask yourself, is this vein big enough to hold the size of needle gauge that I'm going to actually insert into it? With IV supplies, it will tell you what size you have. We have 18, 20, 22, and so forth. And with IVs, the smaller the number, the larger the gauge. I know that's confusing, but just try to remember that. So if you have an itty bitty little vein and your patient needs an 18 gauge, you probably don't want to stick that 18 gauge in that little vein because it's not going to hold it and it's going to collapse. Next is using the wrong angle whenever you go to insert that needle into the vein. You want to use about a 15 to 30 degree angle, and this is going to prevent you from actually going straight through the vein and not being able to advance your cannula. And then finally, failing to prep your IV supplies. So this really has nothing to do with actually inserting the IV, but before you start an IV, you always want to make sure that you are prepped and ready to go because you have a limited amount of hands that you can use to help you whenever you're actually doing this procedure. So whenever you actually get blood return, you're ready to advance, you're limited to like one hand, and then the other hand has to help assist with everything. So make sure that you have everything completely set up, your flushes and everything, for whenever you're ready. Okay, so that wraps up this video, and I actually have a live demonstration of me starting an IV on a patient. So if you want to check that out, you can watch it up here.